Friends, I am Dr. Surajit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 10 homeopathic remedies for marasmus or undernutrition. You can also tell marasmus actually severe undernutrition. What is marasmus? If children suffer from lack of essential elements of nutrition for a long time, up to the age of 5 years, then those children have been suffering from marasmus. Following are the reasons producing this state. A. In food received by the children, there are lack of more than one element of protein, fat, carbohydrate, vitamin, minerals. B. Infection of their health by virus, bacteria, parasites. C. Serious derangement in the immune system of their bodies. Besides, other indirect cause may be famine, lack of foods, intense poverty, fasting, intake of special medicine which prevent absorption of dietary essence from the body. So, this is everything about primary condition of marasmus. Can marasmus affect an adult? Yes, it can. However, marasmus is basically related to children. Just note the picture below the child. A adult person is suffering from marasmus. This is seldom seen. Can marasmus be fatal? Yes, it can, if proper treatment is not taken up in time. What are the signs and symptoms of marasmus? Number 1, bone and skin appearance of the body. Bone and skin appearance. Understand the situation. Loss of body weight, rather severe loss of body weight, withering away of muscle, skin of the body, chronic diarrhea and illness of respiratory system, arrest of body growth, dehydration, fetal weakness, value of BMI, basal metabolic rate or index, is very low, death if left untreated. Look on the right hand side, a few babies who are suffering from marasmus. Are marasmus and kwashiorkor the same disease? These two diseases are of same nature, but they are not identical. Please note, this note was not there while I published this particular video on 29th November 2022. Today is 1st December. I have identified that mistake and I am correcting it now. Already 10 views was there. That particular video will be deleted and this new revised will be uploaded with this not included here. It is right, it should be not there. I think that 10% who have already viewed it, they have understood that there must be something like not here. Otherwise the meaning of the paragraph will not be meaningful. Yet I am correcting it. In marasmus there is total protein calorie imbalance. This is the protein calorie imbalance figure. In the body, malnutrition is noted every organ of the child, not every organ of the child from head to foot. But in kwashiorkor, children suffer from severe lack of protein. Here lack of protein is there, but there is little lack of calorie. Calorie is there. So it is also known as protein energy malnutrition. First one was protein calorie. Protein calorie, this is protein energy malnutrition. I think these name are almost same. However, the differences are as follows. You see kwashiorkor, you see these things. These legs are swollen up, hair is spared, moon face, fatty appearance of the skin, swollen abdomen, thin muscles but fat presence. Here everything is skinny. Who are predisposed to marasmus? Children of third world countries attract this disease very much. Children of famine-stricken areas, poverty-cursed regions fall prey to this disease much. Children of nutrition deficient mothers who fail to breastfeed their children are predominantly affected. Deficient health facility and high level of illness tend to increase this disease. It's clear that basically there is dearth or the want of proper nutrition of the children by this way or that way. How to prevent marasmus? Number one, drinking potable water. You will be maybe wondering to learn that there are a lot of countries in the world where potable water, that is real water for drinking, is not available at large. Getting well, healthy and balanced food, the same thing. There are a lot of countries where children do not get this. Following general rules and regulations of hygiene, they do not know. They are quite in dark about these general rules and regulations of hygiene. Keeping body well hydrated, the same thing. Maybe water is there, but they do not know how to keep body well hydrated or importance of keeping body well hydrated. Mothers are to breastfeed their babies at least for 6 months so that children get adequate immunity from diseases. This is another point which may, I mean, may what? Why may? Which will certainly prevent marasmus. Calcarea phos for marasmus. Scrofulous diseases of children affecting the bone in general. Scrofulous diseases means the diseases and the type of diseases which are inherited by a baby of tubercular origin. Debility from mass assimilation of food. Food is abundant, but mass assimilation is there. Children crave nursing all the time. This type of children always sucks mother's breast. Delayed dentition. Fontanelles. Fontanelles picture is seen here. These are called fontanelle. These anterior fontanelle, posterior fontanelle. These are remain open long time. These are large, skull bone thin, soft. Children suffer from hot or green or slimy offensive diarrhea. Complexion shallow. Abdomen sunken. Flabby, peevish. Ear and nose tip cold. Crave salty foods. This is the picture where you can give calcarea phos to the marasmatic children. Calcarea carp for marasmus. Children with atrophy of muscles, soft bones, retarded teeth with deceptive appearance of plumpness from excess fat or pale skin hangs in folds but enlarged abdomen. Scalp covered with cold sweat. Crusta lactea. Picture number 2. Crusta lactea. This is the crusta lactea. On the scalp of the baby, there are patchy whitish, what should I call? These are not actually eruption, but eruption-like things. But these are generally loose. It comes off. They come off. Crustalectia, crust dry, filled with, or sometimes it also filled with pus. The patient or the baby, the baby's other or the baby craves eggs, eat a lot yet emaciated, morbid appetite for indigestible article like chalk, burnt clay, ashes. See this thing, morbid appetite for indigestible article. The baby wants indigestible article like chalk, burnt clay, ashes, etc. Vomiting of sour food, curdled milk, obstinate. His nature is obstinate, cross before stool and faint after. Spine weak, leg curved. Some sort of the appearance is like that rheumatic child. Bones bent, old child yet reluctant to put feet on ground. That is, the legs are so weak that they seldom put their feet on ground because they know that I cannot keep my weight. This is the calcarea carp picture. Natamure for marasmus. Emaciation of neck and throat of children, particularly emaciation is noted in the neck and throat region, very slow to learn to walk. Map tongue. Their tongue is like this, makes this is called map tongue. Though this is not a tongue of a child, but this appearance will be like this. Herpes labialis on the lips there are herpes, weak ankles, bulimy with quick satiety. Bulimy means severe appetite, but quick satiety. Marked aversion to bread, worse from fatty food and milk, sometimes constipation, sometimes involuntary watery diarrhea, often crave salt or complete aversion to it. This is a picture of Natramur. Netam sulfur marasmus inherited psychotic constitution. Psychotic constitution, you have to know the chronic disease theory of homeopathy. In homeopathy, the chronic diseases are of origin. There are three types. Either it is from Sora, or it is from psychosis, or from syphilis. So this is psychotic constitution. Netam sulfur is a good medicine for psychotic. That is, if the patient, if the child comes of psychotic parents, then this should be his medicine or her medicine. Abundant abdomen bloated, abdomen bloated, that is swollen, with much rumbling of wind as soon as the child begins to move, has to run to lavatory, passes watery yellow gushing stool forthwith, tongue dirty brown or greenish thick yellow, pasty coating at the base of the tongue. Shalisha for marasmus, children's whole body emaciated, but the head is exceedingly large. Nervous, irritable, timid. Head perspires easily and forehead cold, better wrapping up head warmly. Great debility in joints, very slow in learning to walk, face pale, earthy. Anorexia with aversion to meat and hot cooked food, desire for cold raw foods. Aversion to mother's milk, if taken at once, vomited out. That is, if mother's milk is taken by the baby, it is vomited out at once. Silicea patient. His patient is Silicea patient. Sanicula for marasmus. Child wants to nurse always, never feels satisfied, but then everything comes up with a gush and he goes deep into restless slumber, that is sleeping. Deep sleep with restless. Awakes again to repeat the same cycle. That is, again he is hungry. He takes a lot of milk from mother's breast, and then again gushing, vomiting out of the same thing, and get into a deep slumber, restless slumber, and again rises to do the same thing. Sometimes one large heavy mass of stool, foul like gluten cheese or dry or small balls must be removed for crumbling at the verge of the anus. That is, both is possible. Sometimes it is like foul old cheese, or sometimes it is small dry balls. That has to be removed mechanically, or maybe crumbling at the verge of anus. The patient craves salt, ice cold milk, thirst little, often. That is, he takes water little but very often. This symptom we also get in arsenic, so it is written there as ars. But ars is not here a symptom, remedy for marasmus. That is not here, but ars has particular this symptom, that thirst little, often. Sulfur for marasmus, body emaciated, skin dry, harsh, wrinkled, giving child a look of old man. He is cross, obstinate, cannot bear to be bathed, heat at the top of head, feet cold. Ravenous desire for sweets, which make him sick. Appetite voracious, huge appetite, grasp at everything edible and eats. Sometimes eat little, drinks profusely. Abdomen distended and hard. May suffer from constipation or slimy, greenish, watery diarrhea. Sudden urging awakens him in the morning, followed by copious watery stool. That is, the boy or baby rather wakes up and went to stool, pass stool immediately. And stool nature is copious watery stool. Phosphorus for marasmus. Emaciation with nervous debility, Brain and spine suffer severely. Face pale, almost waxen, pot-bellied. Frequent exhausting sweats with great debility and orgasm of blood. Orgasm of blood means flushing of blood, moving of congestion of blood in some particular region, maybe face, mainly face, neck region, etc. They suffer from chest diseases. Phosphorus patient is always suffering from some chest diseases, palpitation of the heart, oppression in the chest, crave cold foods, ice cream, susceptible to external impressions like light, sound, pressure, electrical change of atmosphere. That is, during thunderstorm, the patient get restless. Before coming thunderstorm, the patient gets restless. This is electrical change in the atmosphere. Borash for marasmus, excessive nervousness and with malnutrition. They loathe breast milk. That is, they do not want to take mother's milk. Every attempt to nurse causes screaming. Head, palms hot. Face pale, clay colored. Hot mouth. Apathy in tongue. Apathy means ulcer. The ulcer is shown in the picture 1 down. Very fearful of downward motion. If you throw the baby up and then catch him, many person used to do it. The adult person do this. The boy, they throw the boy upward and then catch it. The borax baby will burst into crying with this thing because they fear downward motion very much. Easily started, but other patient may laugh, may smile, may not raise any objection. But if the particular child is of borax, he will burst into weeping. Easily started by slight noise, awakens with scream, cling somebody close forcefully. Varieta carp for marasmus. Pot-bellied with rest body emaciated. Rest of the body emaciated, but belly is pot. Great physical mental debility with constant desire to sleep. His cognitive power is wanting. Cognitive power means actually thinking power, logic power, reading power, etc. Dwarfish child cannot remember anything, does not want to play, sits idly at a corner, wants to eat all the time but averse to sweets and little food satiates. That is, little food giving satisfaction. Crawling sensation at anus, ascarides, that is worms.